Thank you all for joining us today. This is the first of our 2025-2026 seminar series with the Western Center for Ag Health and Safety, and we're going to start off with a really important and timely topic. First, I'll go over a few housekeeping items. This seminar is being recorded, and it should be posted on YouTube, both the English and Spanish versions, in the next few days. All participants are muted, so please use the chat function to submit questions for the Q&A session at the end of the presentation. We will have about 10 minutes for questions, and I will facilitate that with our speakers. As you heard, Spanish interpretation is available, so you can choose either English or Spanish from the interpretation language selection using that globe-like icon. Next slide. For those of you who are new to our seminar series, thank you for being here. We host seminars on a monthly basis from October until June. And the center here at UC Davis is focused on improving the health and safety of agricultural workers in the West. And we do this through research, trainings, and outreach. So you're going to receive a number of different topics over the course of this seminar series this year, and we hope you'll come back for more. Next slide. So with that, I'm going to turn it over to our great speakers from the National Center for Farmworker Health. We have Bethany Boggess and Nick Mandujano, who are going to talk about their research doing community assessments related to H5N1 with dairy workers in several states. All right, I'm turning it over to you, and you can share screen.
Thanks, Heather and the Western Center team. We're happy to be here. I'm going to pull up my slides. And we do have our slides in English and Spanish, and we're happy to share a copy later if people would like that. All right. So we're going to talk a little bit about some series of rapid community assessments we did with dairy workers. We just finished this project last month. We both work at the National Center for Farmworker Health. I'm based in Texas, and Nick is based in North Carolina. So our mission as a nonprofit is to improve the health of farm worker families, and we focus on a couple of different areas. Our main ones are capacity building, primarily for community-based organizations and for farm workers themselves through training and health promotion and health education. And then we also do a lot of farm worker outreach and research and data collection. All right, so let's go ahead and dive in here. So we did a survey in 6 different states and a series of interviews with dairy workers and other industry experts to kind of better understand dairy workers' knowledge and their practices related to H5, to talk about their or to understand their access to PPE and how they were using it at work. And we also wanted to look at if people were potentially contracting H5 and if they were able to get tested for it and if they had any barriers when they were trying to get tested. We also looked at broader stuff that kind of goes beyond the H5 outbreaks that have been happening for the last almost 2 years now. And so those general topics looked at dairy workers' access to health care and vaccines. And then we collected quite a bit of information about who they are, what countries they come from, what languages they speak, etc. All right, so this project that Nick really led with a team of colleagues and local partners, it took place from March through September of this year. And the way we did it, we really wanted to talk to workers in 6 different states in different parts of the country. So we pulled a list of states that had at least 100,000 dairy cows, and that's 19 states. And then we picked 3 states from that list that have not had any H5N1 detections in cattle, and then 3 states that have had detections in dairy cattle, because we really wanted to compare the two. And then in those 6 states, we randomly selected 2 counties in each of those states that had at least 30,000 dairy cows. And we had these minimums because we wanted to make sure that there were enough dairy workers in that county that we would be able to go out and talk to them. We did adjust the counties in a couple of places just because there weren't partners that were familiar with dairy workers or the industry in general. And so our goal originally we had wanted to do 800 surveys with dairy workers. We lowered that a bit down to 700, largely because of the immigration enforcement actions that have taken place this last year. We had to adjust our goals. And then we also did 20 interviews with dairy workers themselves, with industry experts, and people that work at organizations that serve dairy workers. So the way we work in each of these counties, there's 12 counties, we have kind of a circular process, and it starts with talking to partners or potential partners in that county, and then also notifying kind of broader stakeholders that we're planning to do some research in that area. Um, and we want to figure out when we want to tell them what we're doing and why we're doing it. And then we also want to figure out if there's any way we can collaborate or if there's any extra information that we can collect that would help local organizations in their work. So we do that, and then we work with local staff who live in those counties and train them, and then somewhere between 2 and 4 of our staff at NCFH go to the county, and we just collectively go out and interview dairy workers. Usually over about 4 days. Sometimes it takes longer, around 2 weeks. And then we go back once we're done to share the results with the community partners. So how did we find 700 dairy workers in 6 states? Um, we had 2 different strategies. Normally in the past, we've been doing this work for the last 4 or 5 years, and normally we can do pretty rigorous random sampling of people. This year, again, because the politics have just been so different, the climate has been so different, we changed strategy. And so in the states of Vermont, Minnesota, Colorado, and New York, most of the workers we spoke to there were known to the local partners. So they were known to a health center, they were known to like a social service organization. And so we would talk to those dairy workers if they wanted to participate, and we would ask them if they knew of other workers we could talk to. So we kind of snowballed our way, um, primarily in those states. In California, though, and in Washington, it was a little more rigorous. We did kind of a mix of that referral sampling, snowball sampling, and then we also did quite a bit of just going out to laundromats and restaurants and grocery stores and talking to people and asking them if they had worked in a dairy in the last year, and talking to people that way, finding dairy workers that way. Everyone in who participated is an adult. So we had to turn down quite a few teenage dairy workers. There are supervisors in the data set, but we don't have anyone that was paying other people, so no contractors, no employers. And everyone had to have worked on a dairy farm in one of those 12 counties for at least 30 days since January of last year. All right. So here's the list of counties. And we've estimated numbers of dairy workers in each county to get a better idea of kind of how hard or how challenging it might be to find dairy workers in those counties. And there's not really much information about the number of dairy workers, especially not at a county level, but there are really great data about the number of dairy cows. So what we did is we assumed that there's one worker for every 100 dairy cows in a county. And that's how we got this. So we had a range of just 300 workers in Franklin County, Vermont, all the way up to just under 5,000 in Tulare County, California. And that's the highest number in the whole country. So all of our data in here are weighted. That kind of adjusts for the size of the workforce in each county. If you want to talk about stats, we can go into more detail later. But in all, 708 people participated in the survey, and these counties in orange, those are places where there were H5 detections in cattle, and the blue counties are where they were not. So California, Colorado, Minnesota were affected by H5 in the dairy industry. New York, Vermont, and Washington were not. Here's a map. So yellow is affected, and then the blue counties are unaffected. All right, a little bit about demographics here. So overall, we had a heavily male sample. 86% of the people we spoke to were men. And we don't have a full age breakdown here, but it's important to note how many people are over 55. They could potentially be much more vulnerable to different influenza viruses. So really a pretty small number were elders in our sample. About 80% were born in Mexico. We were a little surprised by that. 8% were born in Guatemala and 7% were born in the US. And on average, people had about 8 years of experience working in any industry in the US, and people on average had completed middle school or secundaria. Mostly, most people identified their race as Hispanic or Latino. 85% did, and then 6% identified as having an indigenous race. And then you'll see the chart over here, 15% have an indigenous identity, and we calculate that the same way as the National Agricultural Workers Survey, which you include people that say that their race is indigenous, and you also include people who speak indigenous languages. In California specifically, so we had 129 participants in the state of California. Um, in terms of their origin, it was pretty similar to the overall group. 84% were born in Mexico. Very few people, though, identified as indigenous. And we think that it's possible that we missed some indigenous dairy farm workers in Kern and Tulare counties, but usually that doesn't happen with our sampling methods. So I kind of wonder if in those places the proportion is fairly low, but it certainly could be off a little bit. We had in the interviews we did in the in-depth interviews, people in different places in the country, they were noting that they were seeing increases in women workers on dairy farms and also indigenous workers on dairy farms. So that was especially kind of a trend in indigenous workers on the East Coast. And so we all know that social networks are a big part of where people work and why. So it could just be that the networks are a little different in California. And it was interesting when they talked about why that more women or more indigenous immigrants from southern Mexico and Guatemala might be working in dairies. And one interviewee had told us specifically that that some employers basically preferred to hire women or indigenous workers because they perceived that they were more responsible. And then he also had noted that women are often quite fast in the dairy farm in their work, and that women were going into that industry because it paid better than some of the more traditionally female jobs that were available in the area. And this is a list of languages that people spoke that we talked to all throughout the country. They spoke 21 different languages. 19 of those languages were indigenous languages from Mexico or Guatemala. And overall, the most common languages that were spoken included Spanish, English, Zapoteco, which was very concentrated in Minnesota. And then these other languages, Mixteco, Sautau, Tlapaneco, and Toholobal, those were kind of popped up in different counties throughout our surveys. All right, I'm going to pass it over to Nick to talk about the bird flu stuff.
Perfect. Thank you, Bethany. So I'll be going on most of like basically just about H5N1 questions. So first, one of the first questions that we asked all of participants was if they had heard of H5N1. To note, data collectors were instructed to use H5N1 or bird flu in English and Spanish. As you can see, 61% of the total participants had heard of H5N1. And then there's a difference between the states that are affected and unaffected. And just to remind you all, the affected states are California, Colorado, and Minnesota, and the unaffected states are New York, Vermont, and Washington. And so you can see here that 70% of participants in affected states had heard of H5N1 compared to 34 in unaffected states. Now, because California has such a big dairy industry, a lot of the responses from those participants are way heavier. And you can kind of see here, right, with 75% of Californian participants having heard of H5N1. However, in most cases, right, the knowledge was different. Maybe even if they had heard of H5N1, there wasn't a clear sense or understanding of what it was. For example, this participant said, H5, what is that? How is it? And that was something that we kept hearing from interviewees and even from people or participants in the survey that said they had heard H5N1. The level of knowledge that they had about H5N1 was limited. Some of this, for example, was probably due because the information that they received about H5N1, our survey was focused a lot on the effects on humans and just like risk of that. While a lot of what we kept hearing was that all they were told was that it was something that was happening in cattle and not necessarily in humans, or how to protect themselves. And so we basically asked them of their risk perception of H5N1. Now, for all of those participants that did or said that they had heard of H5N1. So for this subset, it was only a total of 430 out of the 708, right? And so we asked them a series of questions, asking them what would be the effects of H5N1, or what could be the effects of H5N1 in birds, cattle, and humans. And so for humans, 40% of those participants said that H5N1 could cause severe sickness in humans. There wasn't as big of a difference between affected and unaffected states in this case, with 31 in unaffected states saying that H5N1 could cause severe sickness in humans, while compared to 41% in affected states. But again, as I already started mentioning, a lot of the dairy workers actually basically said that they wanted or needed more information, right? Like this participant said, maybe they need to know more information about H5N1 because they really had no idea or didn't know much about it, even if they had heard. So there was a need for information. Training about H5N1, how to protect themselves, how to protect cattle. And of course, there might be differences that we haven't explored between participants from one state versus others, because we did interview dairy workers from each state as well. And then we also asked a series of questions about what they would think would be the risk of contracting H5N1 in a different set of tasks that people do around a dairy farm if they did that task without PPE and the cow was sick. The one that we like to highlight mostly is the perceived risk of milking a cow. So here, 51% of all participants said that there was a high risk of contracting H5N1 if a worker was milking a cow with H5N1 and was using no PPE. And you can see the difference here is about 15% difference in between affected and unaffected states. And so again, just more about this, about the lack of potential information on workers. This participant said, yes, exactly. I mean, the contact is through milk. So, well, like for example, at the farm, it's a dairy farm. So that's where the virus can infect humans. So some of them, they knew how or one of the likely ways that H5N1 would be contracted, but in terms of how they could protect themselves or other measures, they weren't informed as much. And further on, we'll look into PPE use actually. Now, we also asked all participants if since January 2024, they had experienced a series of bird flu symptoms, um, which of course, some of them said like yes, or like they would answer yes, but immediately say, but it was just because of the regular flu or cold. But regardless, 52% of all participants said that they had experienced at least one H5N1 like symptom since January of 2024. 14% said that they had experienced conjunctivitis. And then 43% said that they had experienced no symptom. Now, these questions were select all that apply. Right, so that's why some of these percentages may seem high, but they again a series of different symptoms that we would ask if they had received or experienced. We also asked about the receptibility of an H5N1 vaccine. Basically, we ask, there's a vaccine. If there was a vaccine to protect against H5N1, what would be the likelihood of you experiencing? And so the answer choices were actually they would definitely receive it. They would probably receive it. They wouldn't. They didn't know. They probably wouldn't receive it, and they definitely wouldn't receive. So for this metric, we combined the definitely yes and the probably yes, and then we combined the definitely not and probably not. So 69% of total participants said that they would probably or likely would get an H5N1 vaccine compared to 14%. And you can see the breakdown between affected and unaffected states as well. Now, again, in California, 75% of participants said that they would definitely or would probably get an H5N1 vaccine. Now, something that we asked all of the industry experts and farm worker staff interviewees was if they had done any outreach in terms of potential flu vaccine. And so one of the key things that they kept mentioning was lessons learned from COVID and how the vaccine, if there was a H5N1 vaccine, how the rollout would need to happen. We highlighted this specifically because, as we saw, there is receptivity about a vaccine, but as this interviewee said, there are other things that we need to consider when rolling out vaccines in general, right? He says their barriers are not like cultural, religious, or philosophical about vaccinations. It's financial, transportation, language, and general access. They work too much. They have to feed, house, clothe their families, so they rely and they may not have time to go get the vaccine. So, as he said, right, like one of the most effective ways would be to make it convenient and easy for this population to get the vaccine. And so, as I mentioned, we also did ask a series of the recommended PPE use by NIOSH to prevent exposure or protect themselves. We asked general use, like daily, if they used it. Basically, the top 5 that people regularly use were gloves, rubber boots, aprons, goggles, and N95 respirators. And again, this were select all that apply. So these questions we ask each individual item and participants could respond whether they used it regularly or not at work. Now, this use definitely varied depending on the task and whether what the task done on the dairy farm and whether they work directly with cows or outside versus the milking parlor. We also, this is the California specific use. And we wanted to highlight this specifically because I think California had affected by H5N1. And so we just wanted to compare the use of PPE with Californian participants. As you can see, gloves, which was the most common among all participants, was here still the most common, but was lower with only 79% of respondents in California saying that they used it. So there was some decrease in most uses of PPE in California participants. Now, we also wonder where or how they had access to this PPE. And so here you only see the top 5 PPP used in this participants. Now we broke it down between affected and unaffected states. So for the most part, you see gloves. A good percentage is provided by their employer or the farm they work at. Most of them are similar. The ones that are most similar are rubber boots, whether they're provided, goggles, and N5 respirators. Now, again, we didn't look into the task of this particular breakdown, so there could be something there of why they were provided or not, depending on the task that individual participants had. And then we also ask if they had to provide some of this PPE themselves. Again, broken down by affected and unaffected states. As you can see, rubber boots is basically the PPE that most of the dairy workers had to provide themselves. However, as you can see, there is a difference where in affected states, there were more likely provided compared to unaffected states. Now, the thing with these two questions is that sometimes what we heard was that the employer would provide a certain number of said PPE, and then if they ran out, then the worker would have to provide. So there was some cost sharing, or they would buy it at first, and then everything else would be on the employer. So there's some things that we gather from interviews about those differences and how some producers chose to cost share PPE with their workers. Now, we also ask about PPE use to all interview participants. And so what this can see is something that we heard from both dairy workers and staff participants was that PPE use in dairy was difficult at times. One, because of culture and not being used, not enforced. So even like for COVID, right, like something that a dairy worker said was, well, during COVID, use of this PPE was basically enforced. So we grew used to using it. While for H5N1, that hasn't been the case. So if there's really no enforcement, then why would we use it? Especially because they noted that it could lead to some hazards that, or what they saw, some hazards like wearing goggles, right? They would, because of the humidity in the parlor, that may decrease their visibility. And another staff did like an interview participant, like this one said, well, there are dairy workers say, hey, they don't provide us anything, but when they go out to visit farms, they do have disinfectant or gloves, but those dairy workers are like, well, what is that for? It doesn't help anything. So it does depend on the person, their use or not. But they did highlight that maybe it's due because of the lack of information about H5N1 and the potential severity or impact in this population, but also highlighting why it is important to wear PPE generally. Other questions that we did ask was about paid sick leave. It should be noted that across all 6 states that we recruited from, there is some type of provision about paid sick leave. So all participants should have known. So generally, we just ask if they knew or if their employer provided paid sick leave. 66% of all participants said that their employer did provide paid sick leave. Now, it seems like this was higher in affected states. So again, California, Colorado, and Minnesota. Now, something to note, following this, if they said that they did receive paid sick leave, we asked if they knew how much paid sick leave they had. And some of those respondents said that they were not receiving the legally mandated amount of paid sick leave in each state. Now, there might be some lack of knowledge in participants, or there might be other barriers that prevent them from using the paid sick leave that they should be receiving. We also ask about health insurance. So we asked about workers' compensation insurance and health insurance, mostly because we learned that sometimes workers conflate this two. So we asked them separately, and we do make sure to give a blurb about the differences. So based on that, this is 46% of participants said that they had some type of health insurance. This was very different between unaffected and affected states. So only 25% of participants in unaffected states said that they had some type of health insurance, compared to 53% of those in affected states. And one of the things that we want to highlight and use is, because a common theme was, well, there just needs to be more information given out there to workers. And sometimes we create materials, and we often try to see what would be most useful. We ask about their social media use. And so, as you can see, this is how likely they use the social media in their daily life. So 76% said that they use Facebook regularly, 59% said that they use WhatsApp regularly, and 46% said that they use TikTok regularly. This is something new for us. In the past, we've done a lot of rapid community assessments with general agriculture workers. And this is the TikTok use is definitely higher. We're not surprised by WhatsApp and Facebook, but TikTok was definitely higher than at other RCAs. And so something that we really learned, and the findings, again, we'll have a big report that hopefully we can share in the next couple of weeks. But basically, what we learned is that organizations and dairy workers responded to H5N1 based on previous experience that they had navigating COVID-19, right? So some worker, for example, one participant has said like, well, I wasn't given a lot of information about H5N1, but I had gone through COVID and I assumed that some of those preventative measures would help here. And so they did those, right? Or organizations having to change their outreach strategy again to kind of if they were in COVID. So it seems like previous experience, sadly, with COVID-19 helped some of this, I guess, navigating the H5N1. However, again, there is a lack of general education about H5N1. Even in states with H5N1 cases, only 30%, 30% had not heard of H5N1. This is kind of like bad, right? Because based on metrics, there had been cases of cattle having H5N1 in those specific counties. Which also, I mean, the lack of training and information provided to dairy workers by employers is low, right? As I mentioned, a lot of the dairy workers kept saying that, yeah, they might have heard of H5N1, but basically all of the discussion, or most of it, had been about the effect on cattle, not necessarily on what would happen if they contracted with the symptoms. All of that was either through external trainers or outreach staff. Now, because H5N1 and other issues, right, like immigration enforcement, were happening simultaneously, there was even more access limitations to dairies for outreach staff. So they had to adapt some of their outreach methods, even those that they had used or thought that they could use based on COVID or while they were working through COVID. And something that we want to take away, of course, is that there needs to be an improvement and fostering of public, federal, and private partnerships to address infectious diseases in vulnerable populations, such as dairy workers here, right? Public health definitely can learn from all of the outreach staff, but something was clear listening to all of the interviews that without the buying from the dairy industry, there are limitations that and on what can actually be done. So that's one of our main takeaways that we learned through all of this process.
Wonderful. Thank you so much. Bethany, did you want to add anything before we go to Q&A?
No, that's fine. Yeah.
Okay, great. Well, thank you both so much. I think it's really helpful to see actual farm workers' responses to questions about their knowledge and experience with H5N1. If you could unshare the screen, though we can pull it up if people want to see something else. Please put questions or comments into the chat. We have some time to talk a little bit more. I have questions. Um, so one was, I'll start though with one we got from the audience about vaccine receptivity. And so, you asked about whether or not people would be open to receiving an H5 vaccine if it became available. Did you also ask about their willingness to get the seasonal flu vaccine?
We didn't ask it the same way. We actually asked if they had received a flu vaccine in the last 12 months. So we asked whether they received it or not. And for those that said that they didn't receive it, we asked what were the main reasons. Most of the time, it's like lack of time or cost associated with the flu vaccine, or sometimes something that they always note is, well, there was no one telling me that I needed to get the vaccine, or there wasn't a vaccine campaign to get it.
And I think, Nick, correct me if I'm wrong, I just looked up California's 43% of dairy workers in California said they had a vaccine in the last 12 months, which I think was similar overall, around 40%. Um, kind of high, really. It was highest in Vermont. It was over 60% where they have like a universal vaccine program.
I had a follow-up question about vaccines. I think it was maybe an industry or a dairy expert who commented on the importance of making vaccines easy to get, accessible, etc. So first, please correct me if I have the identity of that person, category incorrect. But also, did you hear from participants themselves about what makes getting a vaccine easy to do and removing barriers? You talked a little bit about time, Nick, but are there other factors?
We did ask, but their workers actually didn't say a lot about vaccines. But something that they didn't know was like what are the informations that they would need, which would be like why it's important to get and any secondary effects, but also learning about the process of how the vaccine was developed, which I thought was interesting, right? Especially because oftentimes we don't think they would know about that process, but it is something that they're curious about to know what they're actually putting in their body. So I would say some of that, but Bethany, I don't know if you remember any other comments from workers themselves.
I think people would bring up a lot, especially people who were born in Mexico, just the way Mexico runs vaccine campaigns. It's like a big community event that's done very close to where people live and it's free. And you can get your questions answered. Um, but education is always good, but having free vaccines nearby, I think would go a long ways.
Absolutely. Thank you. I noticed something related to the paid sick leave and health insurance. The number of, or the percentage of people who had either knowledge of their paid sick leave or reported having health insurance was substantially higher among the states that had been affected by H5. And I'm curious if you think, like, what you think is going on there. Is there actually a difference in the two different states or groups at a more fundamental level? Or do you think that employers and community groups had done education about health insurance and paid sick leave in the affected states?
I think for health insurance, like Medi-Cal programs like that just make a big impact, That's really probably a lot of those California numbers driving that. Colorado also has, some good policies, pro farm worker policies and things that have an impact. Um, I think overall, I don't know if Nick would agree that I think in some ways conditions were just not great in New York and Vermont, especially. And it could be related to the size of the dairies. I think even when we were there, we saw really big differences in PPE access and training and general hygiene in dairies that were larger versus those that were smaller. Um, so that can be some of it too, I think, really, is the smaller dairies just they can't afford paid sick leave or they can't afford health insurance. And there is no public option, which we don't have that in here, but that was the biggest source of insurance for dairy workers was some type of public plan. It was like 22% of the total sample had a public insurance plan.
Got it. Thank you. It wasn't as striking to me with paid sick leave because I could imagine there being community efforts to raise awareness. But when I saw the health insurance number, I was curious. So Medi-Cal being an example of an option in California makes sense as to why that number is so different. We have a question about hand washing, hygiene, whether or not access to hand washing facilities was nearby, how was reusable PPE such as goggles cleaned. Were you able to ask about that?
We did ask about basically hand washing stations. We didn't ask about proximity, but we did ask if they were readily available for them to use. So we did ask about that, and we also followed up and asked if they were stocked with soap and clean water to wash. I don't have the exact metric, but we can get that information. And the reason why we thought to ask specifically about if they had soap and water is because based on focus group discussions with dairy workers in the past, I mean, there may be hand washing stations, but there might not actually be soap for them to properly wash. But in terms of PPE use, we did not ask about how often they were cleaned.
Great, thank you. So we're in October now. We had already seen quite a bit of H5 in dairy cows and poultry processing or poultry last year at this time. Well, there are some cases in animals in parts of the state, not in the western part of the state yet. Do you have thoughts on what's going on there? Why we aren't seeing cases or more recommendations for both community groups, workers, and employers on how to prepare for the potential cases coming this season?
I can share one example of how people were preparing. We went to one farm in New York that I was really impressed. It wasn't a huge farm. They had like maybe 35 employees. Um, but they were so good. I mean, all the workers said, yeah, we've had like multiple tailgate talks about this. And workers who worked in the hospital on the dairy, they had a vet actually come in and tell them, like, this is how you recognize signs of H5 in cows and train them on the PPE that they needed to use if they saw that. And it really was good. And it was encouraging to hear that at least that producer was being very proactive about it. And they also shared what protocols they had put in place to prevent H5 from getting onto the farm, so they weren't bringing in naive animals and things like that. Everybody else seems like cross your fingers approach, maybe. Um, so, but that was a great model, and it, certainly could be implemented on other farms to prepare for a reinfection or a new infection.
Great, thank you. It is time to be prepared. I think that with bird migration happening and everything else, we do need to be prepared, and then also cross our fingers that it doesn't happen. But before crossing fingers, we need to make sure that we have PPE in place and people are trained on what they're supposed to do.
Oh, and you asked about why we're not hearing about it. I don't know if Nick has thoughts. It's probably a perfect storm. Like, I don't know if anybody's noticed, but the federal government's gotten a little slow, a little bit discombobulated lately. And information is coming out very slowly. It might be a combination of, a lot of animals have built immunity from the last outbreaks, and who knows how reliable or quick the information is right now.
Yeah, I mean, the other thing, like in terms of like dairy workers, something that we kept hearing is one, even if they thought that they could have this, right? Um, there were a lot of barriers when getting tested, both like because of how the testing is done, but how the healthcare system is set up, and their access to it. So that's one. And then the other common thing is like for them, if they didn't have information, they were like, well, how do we distinguish H5N1 symptoms versus the cold or the flu that we regularly get just from occupational hazards, right? So you could all like that could also add some to it as well.
Absolutely.
Yeah, that I'll add one thing we did. So out of 700 people, we did end up talking to three people that had tested positive for H5N1. We met them all randomly. Those three people were in California. Um, all three of them where they got tested, which, only 36 dairy workers tested positive in the whole state. So it was kind of crazy to just run into three of them. But we were interested because Nick showed those slides about people that had symptoms of H5. Well, if they had, we asked them, was it within the same month of cows testing positive or cows having the bird flu symptoms? And there was a huge difference. So it was all concentrated in the affected states. I think about 20% of the workers in affected states said that they had gotten bird flu symptoms within a month of the cows being sick or positive. So we have to do some more digging there to kind of verify those numbers, and we want to look at the job tasks and things like that. But it was interesting that it was pretty high that people were saying that they were sick at the same time as the cows, and that almost no one said that that had happened in the unaffected states, which makes me think that okay, workers aren't even if they don't know about this virus and the H5 symptoms are pretty, you know, generic in cows. Um, they just weren't getting sick at the same time as cows in the other states.
Interesting. Well,
Yeah.
we look forward to hearing more about that as you dig into it. The other thing that you mentioned that I'm curious if you have findings on yet is the job task association with people having, well, I guess not just testing positive, but if you got any indication on which job tasks in your study were the riskiest.
We were actually talking to Dr. Annabelle Rodriguez about that, about classifying it, and they came up, she came up, or she used the grade system that had been already established by classifying the tasks by basically contact hours with cattle. So we're working on cleaning our data so that we can kind of compare and contrast our two studies on that.
Great.
So
We
no,
look
not
forward
yet.
to it. Yeah. Another thing that I actually had communicated with you all via email about because I'm particularly interested in the ways people found out about bird flu and as well as where people just generally get their information. And so, Nick, I was really interested in your slide that showed the different usage of social media. We also are hearing more about TikTok. And so I'm just curious if you looked at that data by age brackets or cohorts in any way to see sort of who's using what. So as we try to refine ourselves even more in reaching workers, where we should go for who.
We haven't done the breakdown, but I don't necessarily think we need to
Yeah, okay.
do that.
It's
Um,
obvious.
right, yes. Yeah, so I think basically all of the younger to middle age individuals were the ones who would say yes to TikTok. Um, there were a couple like people that seemed older that also did use it, but I think it's just rapid, right? Like with the limited time that they have, it might be the easiest and fastest way to get entertained and potentially get information. Um, so
Yeah, absolutely. I forget early in your slides there was the question about whether or not people had heard about it. And then also, you went into the depth of knowledge. But do you know who was how people were informed? Was it oftentimes through community, through employer, etc.?
it was a combination. I think for the most part, like those that had heard and had like good knowledge about H5N1 was mostly through outreach workers or some external training. Those that had heard of it but didn't really know much was either through an employer telling them about H5N1 or hearing it on the news or social media.
Right. That lines up, right? I think that's sort of what we would expect. And I think maybe as we go into this new season, perhaps continuing to work with employers to get good education resources out and do education prior to cases showing up in their operations might be a strategy.
Yeah, I think so, but I mean the other thing that we do need to consider, right, is everything else that is going on. I think an expert or a staff was saying like, well, we're competing against some other priorities that this population is facing, so we also need to take that into account. Because yeah, it might be important public health, but in terms of just safety in general, um, that it, we might need to think better on how to approach both dairies and dairy workers.
I think that's a really important point. Absolutely recognizing the suite of concerns and issues that people have, especially right now, is really essential when we come with new things to be worried about or consider in the workplace, um, or in regular life. I think I'm going to give you each, if either of you have any last comments. We don't have any more questions, but any last words on future directions?
I would just say, please let us know if you want to collaborate. We can provide data about California or other places, and we can do data use agreements too. We want the information to be used as much as possible.
Amazing.
Yeah, just to tag on with that in Bethany, right? Like each survey had additional questions specific to California. So if you're curious about what those were, let us know or we can do cross tabs as needed. I think, for example, one of the questions specific to California was if their farm or the farm that they worked in were under quarantine that dinner period.
Perfect. Yeah, that's important. Thank you. Great. Well, I want to thank you both so much for being here. I also want to thank everybody who attended. Thank you for joining, and please consider registering for next month's seminar. We are going to be, I think it's November 3rd, the first Monday of the month. Dr. Farzaneh Khorsandi is going to be talking about ATV safety, something that is incredibly important because ATVs in ag are quite dangerous. So we hope you'll join us then. Please reach out to Nick or Bethany if you have additional questions, and have a wonderful afternoon. Bye.